My name is Elizabeth Winters. I'm a psychology and pre-nursing major, and I studied the nursing education system in the United States and Switzerland.
My name is Salar Kalexadagan, and I studied biological sciences and sociology at UMBC. And the topic that I studied in Switzerland was access to healthcare for undocumented immigrants.
My major is health administration and public policy, track 3 public health, and I'm minoring in biology and sociology. And I took this class because I really wanted to learn about how I could apply international research to research that I'm doing at home at Johns Hopkins Applied Physics Laboratory.
My name is Savita Moses, and my major is information systems, and my research topic is how Switzerland is adapting to new transportation technologies. Switzerland makes it really easy for you to get from one place to the next in very little time. You can get literally anywhere in Switzerland by just using their public transportation system. It's not the technology that makes their transportation so successful, it's the organization of their transportation system. The technology that they use merely supports the ideas that they have. So they don't necessarily sit there trying to find technologies to make their systems better. They sit there and they analyze what their needs and requirements are, and then they find technologies that can make those things happen. You know, talking to my primary sources through email or phone would have been one thing, but being with them there in person and being able to see the pictures and documents that they were showing me of their transportation system was a completely different thing. And by meeting with them one-on-one, I was able to really connect with them, and especially with the representative from the Federal Office of Transport. So actually going there and being able to use their public transportation system and watch it function was an experience I could not have gotten here.
Having the chance to go to both Switzerland and Italy and viewing two different models of rehabilitation and healthcare in the same short period of time was really beneficial, because I was able to see a really highly technological setting in Switzerland versus Italy, where it was much more low-tech, much less expensive, but still seems to be very effective. So in Italy, I had the chance to visit a program called APA, which stands for Adaptive Physical Activities. And that program is designed for individuals who have experienced stroke or have other disabilities such as back pain or Parkinson's disease. And it's a way to use exercise and activities in a community and group-based setting to get people back to their hopefully healthier condition. The experience in Switzerland was really amazing for what I was studying. I had spent a lot of time looking at papers and articles about the status of healthcare for those who are undocumented immigrants, both in the United States and internationally. But I was so focused on the small details that I really lost sight of some of the bigger pictures. So my meeting with Dr. Kestering really brought back what really mattered. Before going to Switzerland, I was really unsure of what I wanted to do. I had the interest in medicine, but I saw a lot of the problems that healthcare professionals are facing in the United States. I was able to see that Dr. Kestering was really, after all these years of practicing medicine, he was still doing what he had wanted to do as a young physician. You won't get your thesis done in a week, but you really get your foot in the door and you get a taste of what international research is about.
Looking at receding glaciers in Switzerland directly related to water and food security. Water security is threatened when climate change impacts glaciers and leads to a reduced amount of water and resources. After I came back from Switzerland, I was able to apply what I had seen firsthand and the research I had done in regards to receding glaciers and climate change and their public health impacts to my job at the Johns Hopkins University Applied Physics Laboratory. I thought it was interesting how I could bring my experience from Switzerland back to my job and make a meaningful impact that other people thought was important too.
If I were to compare the U.S. to another country, I'd want to compare it to a country that is considered to be an affluent country. So I chose Switzerland because it is an affluent country and they have many of the same resources that we have towards healthcare. So I was able to go to this world-renowned clinic, Clinic Valenz in Switzerland. I was able to see lots of state-of-the-art equipment that they were using. And they also spoke about all the different ways that they use to help patients rehabilitate from several different types of illnesses or injuries that they experience. And it was something that I hadn't really considered before as something that would be a responsibility of mine, which would be rehabilitation. It opened my eyes to how I should focus my studies and how I should focus my research, or how I should focus my practice as I become a nurse.
A university setting, we really learn extensively about research, and we become proficient at finding out about the different things that are going on around the world. But sometimes there are cultural differences, and until you actually get the chance to enter that different culture and see the beauty of it, it really doesn't allow you to completely understand what that particular research is all about.
You don't really understand what a country is like until you've gone there. And I think that the experiences that you get going to Switzerland or any country with the International Field Research Program are invaluable to your learning experience.
I would highly recommend it to other students. I've already told a bunch of my friends about the program. I've told as many people as I could to go to Switzerland. I mean, it's a really, really unique experience and a unique program.